Leave that story there, and I'm sure the State Commission of Inquiry will continue this afternoon. Now, the Health Minister, Dr. Zweli Mkhize, on this World TB Day, is currently making an address. Let's take a listen.
Who came to raise that we need to focus on this, and they were prepared to be a partner in this kind of effort. As part of our effort to minimize the disruption on access to health services and promote adherence to TB treatment, we continue to encourage our chronic patients to make use of other safer, cost-effective and convenient methods of accessing their life-saving medication through what we call the CCMDD, the Centralized Chronic Medication Dispensing and Distribution Program, without going to the health facilities. CCMDD offers a simple, fast and efficient service for TB and other chronic patients to collect their medication from a wide range of safe and convenient medicine pickup points, saving time and reducing transport costs. And of course, as we say safe, it helps them to avoid being in places where they could easily be infected, as we have the pandemic raging. Department, in collaboration with various stakeholders, including the WHO, will continue using a variety of platforms to raise public awareness around TB and to promote treatment adherence, regular screening and testing. Our catch-up strategy to ensure that we disrupt onward spread of TB in our community includes the following interventions, which provinces are already implementing: demand creation through communication, social mobilization and civil society engagement, integration of TB, COVID-19 and HIV services, strengthening airborne infection control practices in our health facilities, exploring innovations to ensure treatment adherence, delivery of TB medicine at home or collection point convenient for the patient, remote or face-to-face adherence support and appointment system for follow-up visits, and leveraging COVID-19 digital health solutions for TB self-screening, contact tracing and screening, real-time surveillance system for TB notifications and TB deaths, geomapping and hotspots identification for intensified response. Improving access to social protection for eligible patients. This would be guided by the results of the TB patient cost survey, and then lastly expanding eligibility for the latent TB treatment for all households contacts of TB, including shorter regimens for the treatment of TB infection. This was raised by the Deputy Chair of SANAC, and it's an issue that we'll be giving attention to, and the need for us to focus on those shorter effective treatment, which is a combination of drugs that shortens the treatment to something like 6 months. I think it's important to ensure that we keep the adherence and the compliance by ensuring people can get treatment early enough. Also, the issues we have also, of course, been using the preventative, what is called the IPT, the isoniazid preventive therapy, which has also assisted to improve the mortality, reduce the mortality on HIV positive individuals, because of the fact that if you start early, then the treatment is improved. Of course, we have to intensify our work on not only just normal treatment for tuberculosis, on the drug-sensitive tuberculosis, but also to increase the recovery and the survival of people who are infected with multiple drug-resistant tuberculosis. We are quite aware of the concerns that have been raised, issues that have been raised about what we would need to do to strengthen the partnership with various community structures. The need for information, which has been tabled here, we believe it is important to drive the campaigns, the advocacy campaign amongst the people who are part of the civil society bodies, the financing of the structures that support these advocacy programs, and in particular those who are actually helping to deal with issues of treatment literacy, adherence, and also the reduction of defaulting and increase the recovery. We believe that we need do more work in this regard to try and ensure a very strong support from that particular area. The sectoral mobilization is important to deal with the issues of stigma and also to make sure that tuberculosis does not get neglected. I think what we have seen, particularly from April coming this way with the lockdown, we were shocked to see the level of reduction at that point. And therefore, it's important for us to integrate all these platforms where we deal with tuberculosis, COVID-19, HIV, malaria. All of these are going to be very, very important. Another important point raised about extrapulmonary tuberculosis is also quite an issue that I think is important to deal with. In particular, if you look at the TB prevalence survey, that not only showed the high numbers of people who are positive, who test positive for TB, but that is higher than what we initially estimated. But also it is showing that there's a lot more, there's much higher prevalence of tuberculosis on HIV negative individuals. Now these are people on whom our suspicion, our index of suspicion has been low. So it does call on us now to actually go all out to make sure that we widen the net to test and screen and find more people with tuberculosis in order to be able to defeat this pandemic. Particularly the area of involvement of the men sector. It's important as well because I think has been said, the men tend to be the one who shun medical services and therefore will only present if they are completely severely affected or when the situation is such that they couldn't avoid the health services. So I think we need to look at the programs that can actually help us to popularize the screening, the testing, and the detection of tuberculosis amongst the males so that we can deal with the problem as been indicated. Of course, the extension of that to deal with those who are excuse me, in the immediate proximity. But the fact that we have had to deal with COVID-19 has also shown us the importance of the involvement of a whole lot of other pandemic that need to be attended to, such as the issue of gender-based violence and femicide. It becomes important for us not to leave any of these behind because it's the same community. They must get the same message with all the issues integrated, and therefore they are able to deal with it. We note the issues that are raised in relation to equity in access to some of the basic services, some of the basic tools, some of the basic preventative modes of prevention, such as the availability of femidoms or female condoms. We believe that's important to empower and emancipate women to be able to take charge of their own health, of their own body and then their own health situation. We also believe that other issues that need to be given attention, the issue of infrastructure, poverty, unemployment, all of these are actually fundamental in the treatment of tuberculosis. Simple basic issue, having food in an empty stomach makes it very difficult. Then you end up with a problem of where people have got, particularly when it still had so many tablets to take, you just get fed up taking tablets, and that becomes a problem. So compliance gets affected by those particular issues. And the issue of budget, we do note that, however, the real challenge is that the whole country is going through a difficult time. I think our resource constraints are actually affecting a lot of areas, and indeed it's not a matter of whether we believe that there is that health is an area where we can cut. I think it's a challenge that we have to deal with, as it were. But we do agree that we need to move speedily towards the establishment of our national health insurance, because universal health coverage will give us equity, will give us the social solidarity, will give us a kind of system, particularly strengthening our primary health care, so that the early screening, early treatment, early detection and management of pandemics and issues where we need to mobilize community and make sure that people can get treated and screened early, it becomes very important. And these are some of the issues. And we agree that the foundation of economic recovery, the basis for economic recovery is ensuring a healthy nation. So whether we're dealing with the issues of access to vaccine, whether we're dealing with the issues of treatment for TB, whether we're dealing with the issues of fighting HIV and AIDS, all of it has got a cost in terms of economy, the economy of the country. And so it's important for us to make sure that these are taken care of so that we can create this healthy population that will ensure that we can then have the economic recovery. So our multi-sectoral response remains important in the fight against TB. We also want to thank all the multilateral partners that work with us and support us, from the UN family. WHO has assisted us for a long time. We've actually relied on their technical expertise, as well as UNAIDS as well. But also the US government, just as a point made by the Shajay, is that part of the mobilization for vaccine that we've got. Some of the vaccines have actually to be collected from various countries to be available for South Africa. And on a continuous basis, we have to keep checking that those are available, and we actually have been informed that the last batch has been authorized to be released from the United States and a few other countries that have been able to release all these doses for us. So we need to continue to work together with the various governments that are supportive, the Global Fund, PEPFAR, and various other government agencies that are working with us. I think it's important. The important issue here is that at the end of the day, when you are sick, you are sick. Whether it's COVID-19, tuberculosis, or HIV, the main thing is to make sure that you get out of the illness, because there's no better death. No one must actually die of something that can be prevented. Similarly, the survival of people from HIV and TB also means you are certainly now going to have to face non-communicable diseases such as hypertension, heart diseases, cancers, diabetes, and chest or pulmonary diseases, and so on. All of these also need to be attended to. And so when we say the clock is ticking, we basically are saying that the tuberculosis is a preventable, eminently curable disease that we should actually eliminate, because there are others which are going to be much more difficult to deal with, particularly those non-communicable diseases. So we need to send a message to all our people that tuberculosis is curable, and that people must get tested, they must get treated, and then we must all together fight to end tuberculosis, and the clock is ticking, and no one must be left behind. At this point, colleagues and program directors, kindly permit me to introduce and invite the Deputy President to deliver a keynote address. And of course, all of us would be aware Honorable Mabuza hails from the province of Mpumalanga, and he was immatriculated at Kumbula High School and also studied at Mgwenya College of Education. Later did studies with the UNISA, University of South Africa, earning Bachelor of Arts and other education certificates. In these days as a youth, I heard many people here talking about being young. We were once young at some point. Actually, you must know we're very, very active youth those days. And Honorable Mabuza was amongst those who was part of what was called the Azanian Students Organization and other youth organization, and later
Dr. Zweli Mkhize there about introducing the Deputy President, Didi Mabuza, who's going to be also talking on this World TB Day. We listened a short while ago to the Minister talking about the fact, or emphasizing the fact, that tuberculosis is preventable, curable, and all that's needed really is a concerted effort on a multi-sectoral basis for testing and treatment. Now,